effect on health. And we know for kids, we need to focus on the behavior, emotional, and social aspects and how COVID has affected those. As far as some data points for that, we know that reading and math levels have decreased. We know that anxiety, depression, and suicide rates are up in kids. And concerningly, gun violence against kids has increased. These are just a few examples of how the pandemic has affected kids and how it's playing out in our community right now. We need to consider these data points when we think about the bigger decisions. As a community, we are invested in getting through the pandemic and creating an environment of healing and getting back to a state where health and mental, social, behavioral, as well as physical health are things that we're focused on. So we want to make sure that we're doing everything we can right now to limit the spread of infection. Those things that we know that work: get vaccinated when you can, make sure that you're wearing masks, don't go out of the house if you're not feeling well. Those are very simple, very effective strategies that we've been using. So let's move into the data for this week and provide a brief update on how things are going. We are seeing an increase in COVID cases within our Milwaukee hospital, as well as within our primary care settings. We're seeing increased numbers. For example, in the hospital over the past week, we've been averaging about 20 positive cases of COVID-19 in kids, and that's up from a data point of about 15 earlier. And we are definitely seeing an increase in the positive test for COVID in our primary care setting, our urgent care setting, and our emergency department. Fortunately, again, the severe cases remain very rare. We're not seeing kids that are affected as severely, as commonly, but we also want to make sure that we're aware that there are some kids who do get quite sick. One example of that is multisystem inflammatory syndrome in children. We remember that being something that we've talked about previously. To date, the state Wisconsin Department of Health Services has reported 143 cases of that across the state of Wisconsin. So that is a severe form of COVID that we want to make sure that we're aware of. So moving forward, what can we all do to think about where we're going and what we need to do? We want to stress and emphasize it's important to keep kids in school whenever possible. That's been a strategy that has been something that we focused on from the beginning. There have been challenges to that, and we want to make sure that we're clear about that. And that means we need to do everything we can to keep kids safe and healthy. So wearing masks, getting vaccinated, washing our hands, being well when we're in the community, those are things that we want to make sure that we're doing. I want you to know that Children's will continue to take steps to ensure that we have the resources necessary to care for kids. We realize we provide unique services, and we want to make sure that we are able to provide those services to kids so that they can be as healthy as possible. We'll have new weekly updates on what we're seeing at Children's, and this is done on Wednesdays. And we'll also be sharing information on our social media channels as well as our news hub on the Children's website. So that's some opening remarks, and I'll open it up for questions now, Ashley.
All right, thank you, Dr. Goodsite. We have a question here that's all about vaccination rates among younger people who are eligible. Kent says that vaccination rates among the younger eligible people remains low and is lagging behind other age groups. Is that concerning for you? Do you have anything that you could attribute that to?
As a primary care pediatrician, I strongly believe that prevention is the best approach to treatment, and so prevention is the thing that we want to focus on. Vaccinations are a key cornerstone, not just for COVID, but for many other childhood illnesses that we have seen reduced in significant numbers and severity because of vaccinations. It is concerning that the vaccination rates are a little bit lower, and we want to make sure that we're doing everything we can to promote vaccines, to offer information to people so that they understand the importance and safety of vaccines. We have safe and effective vaccines. We want to make sure that we're offering those, and we want to make sure that we give information to families so they can make the best decision possible for their kids.
And we have another question that's about vaccine eligibility opening up to children under 5. Do you have any expectation about when that might happen or any update on that process?
Thank you. I think there's a great deal of anticipation for when the vaccine will be authorized for even younger kids. As far as I understand, what happened is that the data that was submitted initially to the Food and Drug Administration for consideration did not provide the information that, in terms of protection, that was being hoped for. So I think there's more data that's being collected right now. And as far as a timeline, I don't know the timeline at this point in time. my hope is it as soon as possible, but again, we want to follow the science, and this is why the system works, reviewing that data and scrutinizing and make sure that it meets the rigorous standards that we would expect to give vaccine to younger kids is what we want to focus on. So it's encouraging to hear that we're seeking more data, that the government is seeking more data before authorizing any vaccines for younger kids.
Okay, still on vaccinations, what is the biggest issue when it comes to encouraging parents to get their kids vaccinated? Do you have any insight, especially from being a pediatrician, about what might be worrying parents or what the biggest issue is?
You know, I think it's so hard because I think parents get so much information from so many different sources, and it's so difficult to discern what information is factual, what may not be factual, and what may be anecdotal. And so I think my strategy is please seek out information from a trusted resource. And I usually say start with your primary care provider. That individual should be somebody who can provide you with the best information about the science behind the vaccine and the safety of the vaccine. And also reach out to trusted resources such as the American Academy of Pediatrics, the CDC, and the Wisconsin Department of Health Services. There's excellent information available, and hopefully that can help to provide accurate, scientifically based information about the safety and effectiveness of the vaccines.
Okay, and then you had mentioned MIS-C or MIS-C. Can you remind us what that is and why it's detrimental for kids?
Yeah, thank you. And I apologize for using acronyms. We certainly want to make sure that we're as clear as possible. Multisystem inflammatory syndrome in children is an inflammatory condition of the organ systems. It can affect the head, the heart, the lungs, the digestive system. And we see this following in some kids following the infection of COVID. So it can occur weeks afterwards, weeks after the COVID infection may have occurred. So that's the MIC, and we track that because we want to make sure that we're understanding what the shorter term as well as the longer term impact of that syndrome is.
Okay, and we have a couple questions here about COVID-19 data in kids, so I'll try to answer or ask them both similarly at the same time. So it doesn't seem like there's a lot of data online when it comes to kids and COVID-19 here in Wisconsin. I think that is why we've started to do these Wednesday updates to show as much data as we can from the Milwaukee Hospital. But can you talk about a little bit more generally and broadly about what it's looked like for kids over the course of the pandemic?
I'm sorry, Ashley, could you repeat the last part of the question? I apologize. My hearing wasn't quite tuned in.
Sure. So for COVID-19 in kids, can you talk about generally what it's looked like for kids throughout the pandemic? Like things like, has it spiked at any point? When you're looking big picture at the data, what does COVID-19 look like for kids over the last few months or a couple years?
Yeah, thanks. And I agree. It's been a little bit harder to pull out the information for kids. And some of that has to do with reporting and timeliness of reporting and things like that. But what we are seeing is a trend and a pattern. So if we look at the current state overall in terms of case positivity, within the state of Wisconsin for everybody, it's about 25% of positive cases testing positive at this point in time. When we look at the information that we have right now for kids, especially with this most recent surge, with what we're seeing as termed the Omicron surge, we are seeing that numbers look to be higher than they were at any previous time in terms of infectivity rates with kids. And I'm talking about the group less than 18 years of age. Now, some of that is preliminary information, and we're still in the midst of it, so it's hard to give any final data, but we certainly are seeing a surge. And as I mentioned earlier, the case positivity rate within our primary care settings, our urgent care settings, and our emergency department and hospital is up and increasing from previous historic highs that we had seen.
Okay, and then I just want to mention, Taylor, we did see your question about specific depression and suicide rates in Milwaukee and Milwaukee County. The numbers that we have seen and that I believe Dr. Gutzeit referenced are national, but I do want to mention that Monday we are doing a live stream where Dr. Kari, President of Primary Care, will be joining Dr. Gutzeit, and we will be talking more specifically about our area. Okay.
And I really appreciate that question too, because I do think that we sometimes get caught up in the physical effects of COVID with the illness. there is so much more that COVID affects that we just need to be cognizant of. So thank you for that question, and thank you for calling it out as something we want to make sure we're providing the data for.
And similarly, Brittany asked, what are some signs parents should be looking for to see if their child is showing signs of depression, anxiety, suicide? Again, these are good questions for Dr. Kari, who works in primary care, but Dr. Goodsite, do you have any tips for parents what they should be looking for?
Sure, I think parents know their kids better than anybody. If you see something that you're concerned about, or your children are expressing thoughts or ideations that you have concerns about and you're recognizing as potentially issues that you'd like to discuss, again, contact your primary care provider. I know that on Monday's feature we'll be offering some information about resources and things like that. So I think the most important thing I would say is if you have concerns as a parent, seek out guidance from a trusted individual such as your primary care provider or a behavioral mental health specialist.
Okay. And then what are your thoughts about children returning to virtual learning in schools or districts that have temporarily suspended in-person classes due to COVID-19?
Everyone's desire is to have kids physically in school. We realize that is the optimal situation. And as I shared earlier, we've seen the impact of reading and math scores and are concerned about that. I'd also like this time, take this time to express gratitude to our school districts who have done so much over the past 2 years to continue to provide an optimal learning environment despite the many, many challenges that they've faced. That being said, I know there are decisions being made right now about returning to virtual settings and things like that. My suggestion would be that schools really work with their local health departments whenever possible, with the Department of Health Services and other authorities to provide the safest environment and do the things in the school setting that allow kids to stay in school. You know, make sure that the masking strategies, washing hands, and sometimes even using the test to stay program. So you may be aware that the Wisconsin Department of Health Services is partnering with K through 12 schools to offer a testing program, and I would encourage school districts to continue to seek that. Some of them have done that already, and I think that's a very effective strategy.
Okay, looks like we have one more question here. It looks like other local hospitals are experiencing overcrowding and some staffing shortages and have had to shift and reassign staff to meet that need. What's the situation currently at Children's related to that?
There has been a surge, especially in our adult partner hospitals, where we've seen, or adult organizations, I should say, where we've seen the surge of COVID overwhelming their systems. At Children's, our commitment is to provide the especially unique services that we do to all kids that need our care here. What we have seen is that the biggest impact right now is actually illness in the community. So it's not just COVID. We're seeing influenza and other typical seasonal viruses surge as well. And so that's impacting staff, not only at Children's, but across all of healthcare and all other industries too. And so that's become one of the biggest challenges is assuring that our staff are healthy when they're at work, allowing them the opportunity to recover when they're ill, and then managing the day-to-day operations. And what I would say is things I think I've said this before on some of our calls, you know, for the past 2 years, our ability to provide the services is dependent upon a constant vigilance, and not just a day-to-day vigilance, but sometimes an hour-to-hour vigilance of how our staff are doing and making sure that we continue to provide the support that's necessary to make sure kids get the care that they need.
Okay, thank you very much, Dr. Goodsite. I am not seeing any other questions in the chat, so I think we will wrap up there. Thank you to Dr. Goodsite for taking the time to answer questions today, and thank you all for being here. I did post links to our Monday live stream where Dr. Goodsite and Dr. Kari will be answering questions for families, mostly related to schools and testing, things like that, and updates related to COVID-19. So those links are in the chat. If we don't have any other questions, I think we'll call it there. Thank you, everybody.
Please do everything you can to stay healthy too.